Welcome back to the county seat. We are talking today about the opioid crisis. We've got the definitions down right. Now we're ready to talk about policy, opportunities, challenges, and problems. Joining us for our discussion, we have Robert Axon, who is with Senator Mike Lee's office, Sean Reyes, the Attorney General of the state of Utah. Thank you for joining us.
Thanks,
and Commissioner Bill Lee from Utah County, one of the counties that has been in the trenches on this issue, actually one of the first vocal voices across the state. Thank you all for joining us.
Thank you. Thank you.
So, Robert, I want to start just by a headline, because we're going to spend some time talking about this later. What are you working on right now?
Yeah, here in the state of Utah, as any Utah knows, we tend to do well when we come together to try to solve complex issues. It's why you have the three of us here that represent various perspectives. And Utah has done a good job in the past, and we're trying to apply that same approach of bringing people together to tackle complex issues and to figure out what solutions will improve people's and individuals' families' lives. That's what we're trying to do in regard to the opioid crisis. We have a large event that is a statewide event. A lot of people from various perspectives will be coming together to talk about this. It's the 5th annual Utah Solutions Summit, where we'll be talking about really how to cure this, what type of connection can cure this, and folks can come and participate with us next week, Friday, so October the 12th, this coming Friday, to engage in that very discussion.
Excellent. Now, you have some late-breaking news, as I just heard in the Twitter sphere a couple of days ago from some official in the state, I think it was Lieutenant Governor, that we are on a decline as far as opioid overdoses and deaths, and your office has been very active in that.
Yes, about 19% of a decrease, which is amazing. That's the really good news for our state, and it's because we come together, like Rob said, and this event is going to be a really critical piece of continuing to lower the number of deaths. Just to be clear, though, that statistic, those have been out for a while. We have just been re-emphasizing those in our state, and we appreciate everyone who's worked on this issue. Utah is truly leading the way in this fight, and we were just highlighted last week by the White House to come out and explain to the rest of the states and local leadership how Utah is doing this and doing so well. Excellent.
Now, people will generally think this is, not in my backyard, this is not a problem, this is a west side of Salt Lake City problem, but, Utah's a half rural county, and your county has really struggled with this. What are the challenges that face you?
Yeah, this is not in our backyard. This is at our dinner table. This is a conversation that's going on all the time. I rarely run into anybody that has not been affected or that is touched by this, either a family member, friends, relatives, whatever the case may be. It's everywhere. And going back to Sean's comment there on the decline, we would hope that would continue. And so we put things in place like use only as directed campaigns, in which one of our hospitals down there decided they were going to decrease their opioid prescriptions by 40%. That's 5 million pills in our county that are not on shelves, not around for others to pick up. Those kind of things is what we're trying to do to make a positive impact as we try to move forward on this issue.
Chad, and to that point of this not being a rural issue or a west side of town issue, this really affects every family, and it has no barrier. There's no socioeconomics that are specifically targeted by this. It doesn't matter if you're rich or poor, if you're left or right on the political spectrum. It doesn't matter what part of the state you live in. Your family has been affected. There's somebody in the church pews on Sunday next to you who has been affected. There's somebody in your workplace who has been affected. And so really the opportunity that Utah is trying to bring to bear collectively is not only has everybody been effective, but more importantly, everybody has a role to play in solving this. Because even if, knock on wood, your family hasn't been touched personally, there's something that you may be equipped with, maybe some connection you have or some friendship you have where you may be the very person of rescue that somebody down the street needs.
And Chad, again, to that point, for a long time, I think you're right, there was a perception that the only people who were involved in this were junkies or people on the fringes, on the margins. But as both of these gentlemen have said very eloquently, this affects everyone. The trouble is, it's not readily evident. So you might not notice that a soccer mom or someone in your book club or someone that you go to church with or that you work with is struggling from this. But it has a devastating impact on people's lives. If you just look at the numbers, even though our statistics are down in Utah, we still had 360 deaths in 2017, far too many. We had 72,000 nationwide. If you just look at that number,
that's more than the Vietnam
War. That's a great example. It's more than all of the deaths during the entire Vietnam War conflict. And then if you also put it in context, it's more than deaths by accident, car accident, motor vehicle accident. It's more than deaths by breast cancer. And I don't want to minimize how serious of a threat those things are and how devastating they can be. But I think if we were losing this many people because of an outbreak of some virus, or planes were falling out of the sky, or bombs were going off, or natural disasters were occurring with the same amount of deaths, we would all be jumping up and down. There would be so much more attention, and part of the problem and challenge has been getting people to talk about it. There's a lot of shame. There's a lot of judgment. Right. There's a lot of stigma involved. And so Utah has done a great job because of leadership at the county level, like Commissioner Lee, because of leadership like Senator Lee, saying, look, we need to be honest about it. It is not a partisan issue. It's affecting everyone, so we need everybody to come in and stop being embarrassed to talk about it. Good families can be facing this issue.
I would like to ask a question. I'd like to start at the county level. I would like to get your perspective on how we got here, because 20 years ago, you know, there are a few people that had a cocaine problem, but they didn't. There was not an opioid problem, and it was literally a fringe problem. It was a recreational youth thing that people would get out of. This gets everybody. How did we get here, Bill?
You know, that's a great question in many ways, and it's not like we just all of a sudden woke up one night and we were here. Woke up one morning, we were here. This is something that's happened over a long period of time. Opioids have been around for forever. It seems like. So it's nothing new. But part of the reasons why I think we're in this kind of crisis situation is the marketing that has happened. Some of the marketing that has happened with it. Also, some of the fifth vital sign, which we measure to for doctors. That's problematic when a doctor has to measure for pain to a point to where now it affects their bottom line or their company or their hospital's bottom line. That's problematic in and of itself. And so there's multiple areas in which we need to look at and attack, and I think we need to do it, you know, all together, because as we look at it. So, you know, we have some statistics. 90% of more than 90% of the opioids in the entire world are in the United States. Over 90%. So you have to ask yourself a couple of questions. One, why is over 90%? We're over 300 million people in the world. Why is that? Is it something that we just can't handle pain? Are we just can't handle it, or whatever the case may be there? But we need to be able to look at some of the marketing issues that have come about, the false advertising that has gone on, or the pushing in directions to say these are right things to do when they're not.
But that false advertising is historic. When they came out with heroin, they said it's a milder, non-addictive form of morphine, and then they come out with the codones and the codeines and the things, and they always say, well, this is safer than opium, this is safer than morphine, this is safer than all those derivatives in the world of opiates, and then all of a sudden there's opioids.
Yeah, sure, Bill's done a good job of explaining the primary driver.
Right. So if I could, you know, we use fire. And fire is something that I've used professionally as well. And fire in the right mixtures can cut through steel, can bind things together and build magnificent buildings and build things in our lives. But improperly used, it will run through forests, it will devastate communities all along the path. Same with opioids. Properly used and managed can be a benefit to those who are trying to heal. But improperly used, it will ruin lives, it will rip through communities, and it will destroy. And so we've got to be able to acknowledge what's going on.
Commissioner Lee touched on an important part of this discussion as we look to how to address trauma and pain and how Americans are trying to engage with that in their life. If we turn to things like an opioid addiction or use, it creates a situation that leads us to where we're at today. And so before, as we were talking about the number of deaths, it's an important statistic to look at. But a family member who right now is prayerfully considering how to assist and help their child who is addicted, they're not worried necessarily about their child being alive or being dead. They're worried about what's going to be happening tomorrow. Will they be alive or dead? What is the consequence that they're going to create in their life? What are the permanent outcomes that they are creating? And so we can't just focus on the death. We have to focus on the trauma that's being created by this.
One quick note, though, if you read the book Dreamland by Quinones, that's one quick way. It'll save me from spending the rest of the time talking about how we got here, because it's a good gloss of where and how our country is facing this, I call clear and present danger, epidemic level. And I know we want to talk about solutions and how we can get resources to the counties, because that's our audience today, and so I'll refrain because I've got lots of stuff to talk about.
I'll put that back up at the end so that people can see that graphically and get the book. I do want to talk about policy. You know, federally, how are you guys working together? I mean, you're representing Senator Lee. Yeah. He's obviously working on things indisposed this weekend, and understandably so. The state's working on things. Just take a couple of minutes and explain quickly what we're up to.
Yeah, I'll be succinct, because honestly, the answer needs to be in the control and really in the stewardship of folks that I have here to my left. It's the local level. There's things that the federal government absolutely must be engaged on, things that we should be doing, resources that can be brought to bear. But the most effective way that we can address this situation is locality to locality. What we need in Carbon County will be slightly different than what we need here in Salt Lake County. So the more influence, the more opportunity we give to county commissioners, to mayors, to local departments of health, to attorneys general to be able to engage in this issue, the better it will be.
And that's our view as well. But let me show you or demonstrate, Chad, an effective way that we're working together. You asked how we're working together. Very, very well. We have great organizations in the state like U-Co-op that our Lieutenant Governor chairs. We have other ones that are all working together. We have a state opioid task force that his boss, Senator Mike Lee, co-chairs along with DEA District Agent in Charge Brian Besser and myself. And we have people like Dr. Jen Plum from Utah Naloxone and Speaker Greg Hughes and many others. Court McGee, UFC champion who died of opioid overdose, and God gave him another chance, and he's out helping on the recovery side. Yeah. All of these folks are bringing assets together and different perspectives, because for too long we've tried to address this as either a law enforcement issue, a public health issue, and it's really got to be a holistic approach. So we bring all these disciplines together and we empower the federal government. And I want to give credit to the Trump administration. They said, we're not here to supplant anything, we're here to support. Yeah. Here are the resources. That's why they put all their cabinet members up on Friday to say, this is how we'll get resources to the counties and to the state. And at the state, we want the counties also to be empowered. That's why we fought. When we win this case against the manufacturers, yeah, who really did, they not only defrauded the medical community, but they harmed through fraud our entire nation, whole generation of people who are now addicted because of that, or whose lives are impacted and lost. When we win, we have a special structure so that funds will go directly and flow to the counties, so that they, enlightened commissioners like Commissioner Lee, can figure out how best and respond to the local needs. That is a critical piece, because the state and the federal government aren't as good as supporting as the counties are.
We got to take a quick break. We've got to talk a little bit more about this event coming up. We'll be right back on the County Seat. Welcome back to the County Seat. We do want to talk a little bit more about the summit that's coming up and how people can get involved and actually make a difference. Who's this for?
This really is for every Utahn. As you've seen from our conversation today, all we can really do is a primer. We need to continue the conversation, and so we invite all Utahns of any stripe and from any location to come to the Vivint Smart Home Arena next week on October 12th. You can actually go to utahsolutionssummit.com. You can register there. In fact, I'll give you a code right now. If you enter the code COUNTY, your registration fees will be waived. So enter the code COUNTY. Register for it. Be there with us that afternoon. There's a couple of things that you can do as a Utahn. If you want to engage on solving this crisis, one, register for the summit, come be a part of that conversation. Let's see where it goes from there. But two, go and look in your medicine cabinet. What prescriptions exist there right now that you don't need anymore? Figure out a way to appropriately dispose of those. 74% of people who find themselves addicted to prescription medications and to heroin start with a medicine cabinet. They start with a medicine cabinet at home or at a friend's.
The Solution Summit, the Jazz Bear will be there, UFC fighters, NFL players, NBA players, everyone's coming together. So we want you to come. It's free.
It'll
Please.
be exciting.
It'll be a great, great event.
And then then obviously it's for kids, teens, everybody, old people,
Yes.
everybody.
Absolutely.
All
All
right.
are welcome.
Gentlemen, thank you for joining us for this conversation. It has been very important. It's a very important issue.